Hello everyone, this is Dr. Jill and today we are going to talk about contraceptive methods. This is the first video. We are going to have two videos in contraceptive methods. So contraceptive methods or family planning methods are nothing but which help you to avoid an unwanted pregnancy. Alright, so let's see. People say that what is an ideal contraceptive? So an ideal contraceptive will have many qualities, but so that's why it is very difficult to find an ideal contraceptive, right? It may be expensive, it may not be so safe, it may not be very long lasting, or it may interfere with your with your enjoyment of the act itself, something like that. So an ideal contracept does not exist. Everything will have their pros and cons, right? But still there is something known as a cafeteria choice, where you can choose after knowing the pros and cons of every method, right? So cafeteria choice is currently in India. Currently they offer cafeteria choice. If you go to a health worker, they are supposed to tell you all the available choices and you have full freedom of choosing any method that you want to. So any contraceptive will have an ideal use or a practical use, right? So to understand this, there will be a Pearl index associated with every method. So if you see the Pearl index, that will tell you how many failures are associated with that method. So if you want to compare different methods, you can just compare the Pearl indexes. So the one with the least number of with the minimum Pearl index will have the minimum failure, and that will be the best one. Okay, now coming to the types of contraceptives. First you have the conventional one, in which you need to do something at the time of your sexual act. So this is the classification. You can have spacing methods or you can have terminal methods. Spacing means when you want space between your marriage and first kid or between the two kids. Terminal means okay, your family is not complete or you don't want any kids, and you can directly go for the terminal methods, right? So barrier methods, it's just like having a barrier which will not let the sperm and ovum meet. So why we should go for barrier methods? Because it won't have any major side effects. It can also help in preventing any sexually transmitted diseases. It reduces the chances of pelvic inflammatory disease. It can reduce the chance of cervical cancer also. But you will need high motivation to do this, and it is less effective than the use of pill or intrauterine device, and you need to use it every time in every act. So in physical methods, first is condom, which can be male condom or female condom. Yes, right now many of us don't even know that there is a condom for female also. We just know about the Nirodh and Durex, all these condoms, right? So this is the most famous method. So this condom is just like a covering for your penis during the act. It is made of latex or rubber, and it has to be fitted on the erect penis just before you have the intercourse, right? Okay, so every sexual act will need a new condom, okay, and depending on how correctly you use it, the efficiency of condom will be, right? So there are disadvantages and advantages, as we talked about with any barrier method. So you have the female condoms also. Okay, so why they are looking so huge? Because they go inside your vagina, and the inside of vagina is bigger than the outside of the penis. Okay, so that's why it is looking bigger. So these condoms come pre-lubricated. They also will protect you against STDs. They are at a higher side of the cost than the male condoms, and the acceptability is comparatively poorer. So this is how you will put inside. This is how you put the female condom inside of you. It will stay inside while you have your intercourse, and then later you can pull it outside. This outer ring should be outside when you put it. Okay, right. Then there is something known as a diaphragm. So this diaphragm will sit just below your cervix, so that through your vagina and into your cervix the sperm cannot travel, because the cervix is literally protected by a cap, so the sperms cannot go inside. Okay, so this is known as a diaphragm, which also has to be put inside before the act. So it's like a shallow cup which is flexible. Okay, and it needs to be kept for 6 hours even after the coitus, so that the sperms do not slip inside from the side. Okay, so you have to take it out after 6 hours of intercourse. Okay, so there is something known as cervical cap, which is a bit smaller, and then there is something known as a diaphragm, which is a bit bigger, but more or less they work in the same manner. They cover your cervix so that the sperms won't enter inside the uterus. Then you have something known as vaginal sponge, which is also put inside your vagina. It comes with the spermicide. It is less effective than the diaphragm. Then there are chemical methods, which are nothing but spermicides. Means they may be jelly or foam like substances which you have to put inside the vagina, and they will kill the sperms when the sperms arrive in the vagina. So many chemical methods are there. Okay, so they kill the sperm by cutting the oxygen supply to the sperm, but there may be high failure rates, or you have to use them just before intercourse. Okay, and they can be messy on application, and again they may, because they have chemicals, they may not be tolerable for everyone. Then there is something known as the intrauterine device. Okay, so this intrauterine device means there is something, this T-shaped thing, it sits inside your uterus. It will be very small, very small T-shaped thing which will sit inside your uterus, and it will not let you get pregnant. So intrauterine device or IUD can be medicated or non-medicated. So this was what they first had. They did not have any other things, just they were made of metal. They did not have any medication or anything with them. Lippes loop was popular. Then came the second generation, which was mainly the copper IUD, which has 5 years of life. So once you put it inside you for 5 years, you get the protection. Right, so in this, the copper T200B, copper T380A, these are more popular. So the advantages is there is low expulsion rate, lower side effects, and it is better tolerated, more effective. So see how tiny it is sitting inside your uterus. It is very tiny. So the same thing, when suppose it is covered with any hormone to increase its efficacy as a family planning method, then you will call it a hormonal IUD. So they are the third generation IUD which release a hormone also. So you have Progestasert, you have Mirena. Okay, so again the concentrations of the hormones vary, but they are all type of hormonal IUDs. So this is how Mirena works. So many things will happen. Your mucus will thicken, the sperm cannot travel well. So many things will happen. Finally, you cannot conceive if you have this inside you. Right. So IUD causes foreign body reaction. So as I told you, many mechanisms take place. Now this copper T380A can work for 10 years. If you if you get it inserted inside you once, it will work for 10 years, and copper T200 works for 4 years. So like this, different IUDs have different life. So it is easy to insert. It does not need very much specification or specialized people. They are cheap only. Their pearl index is quite good, and you can even lactate, you can breastfeed, there is no problem. Okay, but there are some side effects possibly. It may increase the possibility of ectopic pregnancy, means the pregnancy which does not occur inside uterus but outside somewhere. or in the fallopian tube, like that. Okay. So IUD should be preferred by women who have at least one child, who do not have any infections, who have normal periods otherwise, and who are motivated enough for follow up with their doctor. Okay, and who do not have many sexual partners, who have one partner, so that there is no chance of a sexual transmitted disease also. So IUDs are not recommended for women who do not have even one child or who have many sexual partners, because the risk of infection will increase and that may cause infertility in future for them. So IUD can be inserted during menstruation or your first 10 days, even after your even after the childbirth it can be inserted, even after an abortion it can be inserted. Okay, so there are many options, and you have to follow up. So you have to follow up in some months or at least twice in a year. So there are possible side effects or complications. So if it suits you, it suits you, but some people have more side effects. So what can the side effects be? Bleeding, pain, pelvic infection, and even the very adverse one, very rare and adverse one, maybe perforation also. Expulsion means the IUD will go out on its own, right? So let's meet in the second video. Take care everyone.